a huge amount of biomedical literature which is available for access by many different researchers, medical practitioners, etc. Unfortunately, medical practitioners, they don't really have time to scrutinize all the literature. This is why it is very important to have some data mining approaches, some data mining techniques, which would automatically extract the information from the biomedical literature. And these data mining approaches will help the medical practitioners in their clinical decision-making purposes. Eventually, this will help doctors in their daily decision-making tasks, especially to provide treatment options for patients, for diagnosis and prognosis of diseases, for patient follow-up, for prescription, drug prescriptions, etc.
We've studied the different frameworks that are used for interoperability, and we've seen that we have these frameworks being implemented in the private sector, but there's still a lot to be done in the public sector due to a lot of reasons. For example, a poor understanding of what is interoperability and the culture and the regulatory frameworks. So while doing this research, one of the things that we're focusing on is interoperability for IoT-based enterprises. So we want to see how to make sensors and devices communicate with one another in an intelligent way, and this is where we use artificial intelligence. So just to illustrate this, what we want to do is just imagine having a sensor that is capturing temperature, and then you have the AC, which will communicate with that sensor. So if the temperature is within a particular range, then the AC will stop, and then you can have another system that is causing the windows to open. So all these could be developed by different manufacturers with their own tools and equipment, and they have to communicate with one another intelligently so that they will be able to perform the task, and then we could have a smart space so that we can save energy and have them talk together. Working on a framework that can make these devices communicate together intelligently through the use of AI technologies like ontologies, and we want to implement such a system within the University of Mauritius by deploying a smart campus framework where we will have connection being different between the library, for example, and other systems, and have sensors work together to have a smart campus. And everything will be in a whole solution, secure, automated, and seamless.
Have projects in health informatics, project in bioinformatics, project in IoT, etc. So we have a project in diabetes. So recently we've developed a mobile application which can help type 2 diabetes patients to actually monitor their diabetes status and to undertake physical exercises and to eat well. So this project we have mostly completed, and we had a number of people enrolled in that. And we've noted that the people, when they're using this mobile application, they have improved in terms of their health. The sugar level has gone low. And we think that these kind of projects are going to be very beneficial for the Mauritians because, diabetes is very common in Mauritius. And most people have a mobile phone, so they can use these type of applications.
I offer my reflection on two strategies that I've used during a focus group with my participants. It is a focus group carried out in the context of my PhD study. And during the focus group, students had to write tweets, paper-based tweets, based on some questions given to them. And these tweets were used so that we get students to become more interactive, and they get less intimidated by the focus group environment. These tweets were then used by myself as a researcher to create word clouds so that I get a quick visualization of the data. These tools can be useful for educational researchers for researchers in general. Teachers can use that in their class to get their students more attractive. And for researchers, they could be used as preliminary analysis tool.
This research study is based in the context of the University of Mauritius moving into learner-centered systems. We're looking at students who want to integrate new types of pedagogy, so we want to engage them more into the learning process, and we're looking at how and what types of learning activities can we introduce for learners, and one of them was about productive failures. So the students were given learning tasks where they had to work collaboratively, where they had to submit online through Google Docs, and they need to realize that there are different types of skills that are required when you're communicating in an online environment. One of them is, for example, providing URLs to the actual learning content, and these are sort of basics. What I found was that students react very negatively to failures. They think that they are depressed, they want to quit the course, they don't know how to react to how people would look at them, or how their peers would look at them. So eventually this study showed me that the Mauritian context is a very fragile context, and you need to build trust with students. You need to enable them to understand what learning is all about. It's not just memorizing text. Learning involves a lot of other aspects of developing certain skills, communication skills, reflective skills, metacognitive skills. And also the important part is that you need to communicate to these students. Communication is key.